The increasingly dangerous situation in Victoria has reignited fears of a second wave hitting Australia. Experts are telling people not to panic, but urging everyone to be COVID safe.
Yeah, but what exactly does that mean? Today, reporter Sarah Stewart spoke to an advisor at the World Health Organisation about who should get tested and when.
It's late in the evening, the kids are getting ready for bed. Then out of the blue, one announces,
Daddy, I'm not feeling well.
no one in the family has been around anyone with corona or travelled overseas.
The next morning when you get up, should you do anything?
I'd wait a couple of days because if it's a cold, your child should get better in 2 to 3 days. So the likelihood is it's an influenza-like illness or a common cold. With COVID, children get unusual and vague symptoms, such as they sound as if they're snoring while they're awake. They lose a sense of smell and sense of taste. They can get stomach pain.
Kids don't always have a sore throat or cough. The main thing to watch for is a temperature spike, but keep them home until they get better or test negative.
What about for adults?
If you're in the hotspot, yes, go and get tested. For the rest of the community, just wait to see if you're not suffering from the common cold.
Mary Louise McLaws is a professor of epidemiology and advisor to the World Health Organisation.
So if you're tested too soon, you can get negative when it could be positive?
Correct.
What is too soon?
That's very difficult. You can get infected and it can take up to 3-4 days to start getting symptoms. So if you've been tested just a couple of days before you start getting really obvious symptoms, you can test negative.
You may also get a false result if the test isn't done properly.
And I want to talk to you about the Black Lives Matter protests. We saw thousands of people out all over the country. Why haven't we seen a spike after that?
Perhaps half to 60% wore a mask. Secondly, they don't have a long period of exposure to one another and they're not speaking at each other. And thirdly, they're outside.
So is that why we've seen the Ruby Princess or the aged care homes as opposed to the Black Lives Matter protests?
Yes, the Ruby Princess, the Black Lives Matters are very different. So the Ruby Princess and the aged care facilities act like an amplification. So we know outdoors you're likely to have much less risk.
There are different strains of the virus. It's unknown if Australia's death toll is low because we closed our borders quickly, or our strain is less severe than other parts of the world.
How concerned are you that what's happening in Victoria could spread to other parts of the country?
Oh yes, I would advise that those that live in hotspot areas stay in a 14-day quarantine period, wear a mask when they have to go out, when they have to go shopping, and get tested.
Professor McLaws believes the government needs to act faster on new findings by the WHO, including a new cloth mask that can cut a person's risk of infection by 70%. They should be worn in hotspots and everywhere on things like public transport.
So the outside of the masks should be made from a water repellent material, the inside by a soft cotton so it absorbs any sweat and it doesn't irritate your skin. And then the centre one should be made from something like a polyester that can act like a filter.
Sadly, she believes a vaccine is still a long way off. They have to find it, make it and distribute it, meaning it's unlikely before the second half of next year.
And then we don't even know if that vaccine will be a one-off or whether we'll have to have it annually.